Most patients know dermatologists treat acne and rashes, but did you also know Dr. Cowan is a surgical dermatologist? He performs biopsies and excisions of benign and malignant skin growths on a daily basis. Additionally, he offers Mohs micrographic surgery, which is considered the most advanced, precise, and effective modality to treat skin cancer today. Dr. Cowan had the opportunity and privilege to train under the direction of several nationally recognized dermatologic surgeons at Emory University Department of Dermatology in Atlanta, Georgia. Furthermore, he is a fellow of the American Society for Mohs Surgery, which is a national medical organization with over 1,000 members. Dr. Cowan has excelled along every step of his medical education, from being elected to the prestigious Alpha Omega Alpha Honor Medical Society, which is the highest accolade given to a medical student, to being elected by his dermatology peers to serve in a leadership role as chief resident to presentations at local and national dermatology meetings. However, it is Dr. Cowan's dedication to his patients and caring bedside manner that sets the practice apart.
So the importance of early skin cancer detection is to attempt to find the skin cancer when it is at its smallest point. So you really want to try to get skin cancers when they're very small, to try to prevent distant spread, because that is a possibility with skin cancers like squamous cell and melanoma. Basal cell skin cancer, which is the most common type of skin cancer, typically does not spread through the blood. Typically it will just kind of grow and consume neighboring healthy tissue until it reaches a certain point that it becomes symptomatic to patients. So our attempt is to get the skin cancer at the smallest point possible. The resultant scar will be smaller, and in various cases, the risk of metastasis or spread through the blood is lower.
In performing Mohs surgery, Dr. Cowan serves the dual role of skin cancer surgeon and pathologist. He has extensive experience in treating complicated skin cancers on the head and neck, and will do everything possible to ensure your cosmetic appearance is exceptional. Some cases require Dr. Cowan to work in partnership with other physicians, such as ear, nose, and throat specialists, plastic surgeons, and radiation oncologists. Mohs micrographic surgery is the most advanced and precise method of skin cancer removal.
I had a sore on the side of my jaw, and I was a little bit concerned about it, and then I had another sore come up on the side of my nose that I was really concerned about, so I went to a physician and he referred me to Dr. Cowan. When I first met Dr. Cowan, he was a little concerned too, but he put my mind at ease because he told me that he would do a good job. It really scared me because I thought, I'll never look the same. That was my first concern. I'll never look the same. I always worried about that. And now I can go out and nobody knows anything. I have friends that I have, known for 20 years that does not know that I have anything done to my nose.
According to the medical literature, the cure rate is 99% for new skin cancers and 95% for recurrent tumors. No other method of skin cancer removal can match these results. The Mohs micrographic technique was developed in the 1930s by Dr. Frederick Mohs, a general surgeon at the University of Wisconsin. The process has undergone many refinements over the years and is now simply referred to as Mohs surgery. It involves a detailed and meticulous map of the skin cancer roots and examination of the entire sample of tissue. All the side edges and deep portion are examined under the microscope by Dr. Cowan to ensure the skin cancer roots have been completely removed. Then he will reconstruct the wound in the most cosmetically conscientious manner possible. The visible portion of the skin cancer is often just the tip of the iceberg, with more tumor cells growing downward and outward into seemingly normal skin, like the roots of a tree. By examining the tissue under the microscope, Dr. Cowan can precisely remove residual tumor cells with the least impact on healthy surrounding tissue. If you are scheduled to have Mohs surgery, you can be sure you are receiving the highest standard in skin cancer removal with the lowest recurrence rate. Since Mohs surgery removes only the tissue containing tumor cells, your scar will be as small as possible. Good cosmetic results are important to Dr. Cowan, and he will do everything possible to achieve exceptional results. Mohs surgery is indicated for skin cancers in anatomic areas in which preservation of the maximum amount of surrounding healthy tissue is critical for functional and/or cosmetic purposes, such as the eyelids, nose, ears, fingers, toes, and genitalia. Furthermore, Mohs surgery is performed under local anesthesia, which eliminates the risk of general anesthesia. You will experience no more pain than what was felt during the initial biopsy or sampling of the growth. Complications such as pain, bleeding, and infection are rare, and most patients return to their daily routine shortly after surgery. Bowling Green Dermatology and Skin Cancer Specialists is honored to offer this advanced skin cancer treatment to the residents of South Central Kentucky. Currently, no other physicians offer Mohs surgery in this area. Mohs surgery is the only method which examines 100% of the tissue margins to ensure the tumor is completely removed. Dr. Cowan will help you determine if Mohs surgery is the appropriate solution for your skin cancer. In addition to Dr. Cowan's expertise, the successful completion of Mohs surgery requires the coordinated efforts of a highly trained team of support staff. 2 certified Mohs histotechnicians process the tissue, cut it into thin layers, and stain the specimen so Dr. Cowan can examine it for the presence of residual tumor cells. If skin cancer is still present, the involved area is carefully marked on a paper map, and the patient is prepared to undergo removal of another layer of tissue. It is important to note that any additional tissue is removed only from the area or areas in which cancer cells are still evident on microscopic examination. This process is repeated until no further skin cancer is found. This preserves as much normal, healthy skin as possible while providing the patient with the best possible outcome. Once the roots of the tumor have been completely removed, Dr. Cowan will discuss the options for repair of the defect. He is very concerned about the cosmetic appearance and will do everything possible to maximize the aesthetic result. Surgical closure may include allowing the wound to heal without stitches, which is called granulation, stitching the wound together side to side, or placement of a graft or local tissue rearrangements called flaps. Additionally, you may be asked to return to clinic several days following Mohs surgery to have the wound closed in a delayed manner. The wound will be bandaged during this time, and the impact on the patient is minimal. Post-operative care instructions, as well as oral and topical antibiotics and pain medication, will be provided if necessary following your surgery. Dr. Cowan also personally calls each patient later in the evening following Mohs surgery to make sure there are no complications such as pain or bleeding. It is this attention to detail that sets Bowling Green Dermatology and Skin Cancer Specialists apart. We hope this information provided about Mohs surgery helps you understand why Bowling Green Dermatology and Skin Cancer Specialists is the regional leader in the treatment of skin cancer. We appreciate your trust in allowing us to provide you with the best care possible. Visit our website or call for an appointment today. More information regarding Mohs micrographic surgery can be found at www.mohssurgery.org.